Hi, and welcome back to my channel. My name is Charlotte, and I'm a breast cancer survivor. Over the last few months, in a series of short videos, I've been sharing my breast cancer journey with you. If you've missed any of those videos, I will leave links throughout this one so that you can go back and view them. Now, in this video segment, I'll continue sharing the details of both phases of my DIEP reconstructive surgery, my recovery, and I'll also be concluding my breast cancer journey. Now, just to recap a little, in the last video I shared that my surgery was scheduled for Friday, August 3rd at 7:30 a.m. Normally, it should have only lasted 8 to 10 hours, but because of complications, I came out of surgery at 2:00 a.m. Saturday morning. Now, the complications arose when the blood vessels that had been transferred to both breasts stopped working, but not simultaneously. The surgeon completed the first tissue and blood vessel transfer to the right side and had started working on the left side when the blood vessels on the right side stopped working. He completed the transfer to the left side and went back to fix the problem on the right side. While repairing the problem on the right side, the blood vessels on the left side stopped working also. And then he had to go back and repeat the repair process. I was told that while the surgeon was repairing the blood vessels, the assistant was cleaning inflammation from my lymphoids. I also required 2 blood transfusions during the surgery. Now, after the blood vessels had been repaired and the surgery was completed, my arms were restrained with tape to prevent any movement while I was unconscious in recovery, as any movement could damage or tear the blood vessels that had been repaired. When I was finally out of surgery, I was placed in the intensive care unit of the burn ward. Now, I was placed in the burn ward because of the type of surgery that I had, the deep tissue transfer, not because of the complications that occurred during my surgery. At one point, I remember subconsciously thinking, why can't I move my arms? And I kept trying to straighten them out because they were beginning to cramp really badly. And this is exactly what the doctor was trying to prevent. On Monday, I was finally coming out from under the anesthesia, and then I saw that my arms had been restrained to prevent any movement. When the doctor came to visit me that day, he told me about the complications of my surgery, and he explained to me why my arms had been restrained. Now, before I could be released from the hospital, I had to be able to walk without a walker. I had to be able to take a shower and to go to the bathroom without any assistance. All the things that I would need to do once I was at home. And then I went home that following Sunday. The caretaker that assisted me after my first surgery wasn't able to assist me at this time because of a conflict in her schedule. So my daughter came over and made the necessary adjustments in my house for me to be able to function as best as I could. My daughter also came over to assist me when her schedule permitted because she was working. And my granddaughter came over and stayed with me a few times when her schedule permitted because she was still in school. During my recovery, I was required to sleep upright. Now, under normal circumstances, I would have only had to do this for 2 weeks, but because of the complications, I had to do this for 3 weeks so that no stitches in my abdomen would be torn. I could only bend my arms from hand to shoulder, just like this. No more. And under no circumstances could I raise my arms. I also could not straighten up when I walked, so I had to walk bent over. Fortunately, I did have a cane from a prior knee injury, so this came in handy at this time. I had 4 drainage pumps, 2 in my breast and 2 in my abdomen, to drain fluid to prevent fluid buildup. Like before, I had to monitor and record the amount of fluid that was draining 3 times a day and give this information to the doctor when I went in for my follow-up appointments. Because of what happened the first time, the doctor was a little more cautious and hesitant about removing the drainage pumps too early. Also, like before, I couldn't shower, I couldn't have any water touch where I had had the surgery and I could only take sponge baths, my mom made herself available to take me to all of my follow-up appointments because, of course, I couldn't drive. I received lots of cards, flowers, text messages from co-workers, friends, and church members. And while I was happy to get the cards and to talk to people every now and then and to respond to their messages, I did stress to people that it was okay if they not come and visit me personally. This way, I did not have to get up and prepare myself for home visits because that was a lot of work. 3.5 weeks after my surgery, during my follow-up visit with the plastic surgeon, he finally told me that I could start standing up straight and begin lifting my arms. I could take a shower and I could finally lay down in bed. I can't begin to tell you how painful this was and how afraid I was to even try this. However, after a lot of practice and a little time, I was able to start standing up, to start raising my arms, and I was very happy to be able to lay down in bed and not have to continue to sit up to sleep. But now I even subconsciously sometimes catch myself when I'm standing up over the sink, leaning over, and I have to force myself to stand up straight. During my 6-week post-surgery follow-up, the doctor removed the final 2 tubes and we began to discuss dates for the final part of my reconstruction process. The last and final surgery would take place on November 3rd, exactly 3 months after the tissue blood vessel transplant surgery. Now, the plastic surgeon explained to me that the reason he wanted to wait for 3 months was because he needed to allow all of the swelling to go down, and this would allow for greater accuracy with sizing. Now, I had to have a few discussions with the plastic surgeon and even a few more discussions with his assistant to get a really clear understanding of how sizing is determined before I could decide what the best size was for me. Clarity to me at this point in the process was very, very important so that I wouldn't need to undergo any surgical readjustments later. Unlike before with my prior surgery, this time I reached out to friends, church members, and my prayer team to provide a support group for my family during my surgery. I told them the date, place, and time of the surgery, and with my mom and daughter's permission, I gave them their contact information. And I asked them if they would please reach out to my family on the day of the surgery and see how they were doing, see how the surgery went, and to see if they required any assistance. Like before, the doctor's office gave me a list of specific garments that I would need to purchase, a high-waisted body shaper, and a larger size bra. And I had to bring these items with me to the hospital on the day of my surgery. I made sure that I purchased 2 sets because I had to wear them every single day. My last surgery went off without a glitch. I hazily remember the nurses putting the body shaper on me after this surgery had been completed while I was still on the operating table. That part I remember because I was coming out from under the anesthesia and it was very cold and I was in a lot of pain. I remember the nurses putting warm blankets over me until they brought me to my recovery room. I stayed in the hospital overnight, which is normal for this procedure, and then I came home the following day. Now, like with my prior surgery, I had drainage tubes and I followed the same procedure, draining the tubes, recording the information 3 times a day, and providing it to the doctor when I went for my follow-up appointments. Recovery at home was not as bad as before, and although I had restricted movement, I did not require assistance this time. During this time, I was having Herceptin infusions also, and my last infusion was on Friday, November 16th. All of my follow-up appointments went well, the fluid buildup was slowing down, and the tubes were removed the week after Thanksgiving. My doctor released me to go back to work on restricted duty on December 3rd, 2018. I had actually been home in 2018 for 6 months on medical leave. My cancer has been in remission for 2 years now, and my reconstruction work is holding up very well. Looking back sometime with tears and with a very grateful heart, I know that God and God alone brought me through this journey. I have learned to be grateful for the small things, not to take things for granted and people for granted. And I'm also grateful to God for all of the people that He planted in my life during this season, and for those that He allowed to cross my path, even temporarily. Also, I want to thank you for allowing me to share my journey with you, and I hope that in some small way, it has helped someone who may face this situation later on in life, and even someone that is currently facing this situation. As always, thank you for watching and listening. God bless you.